everyone. My name is Tam Dinh. I am a social work professor. I'm currently working at St. Mark's University, and a lot of my area of interest is in mental health, in addiction, and working with the refugee and immigrant communities.
Hi, everyone. My name is Ruth Yáñez, and I am the program specialist for the National Hispanic and Latino ATTC, as well as the National Latino Behavioral Health Association, NALBA. And one of my areas of expertise is in being able to provide culturally responsive treatment and mental health services, as well as the mental health with the immigrant population.
Hello, everyone. Maxine Henry. I am the Associate Director for our parent organization, the National Latino Behavioral Health Association, or NALBA. And then I also am the Program Director for two of our federally funded projects, the National Hispanic and Latino Prevention and Addiction Technology Transfer Centers. One of my areas of expertise is in helping to build the capacity of Latino-led and or Latino-serving behavioral health providers and organizations in order to increase equitable access as it relates to culture and language for Hispanic and Latino community members across the nation.
My name is Tam Russell, Assistant Director with the Evergreen Council on Problem Gambling, and it is my pleasure to welcome these amazing guests out to focus on the future in April. We look forward to their sessions and lending their expertise to help inform our viewers and attendees of some very important topics. All right, excellent. So, Tam, let's start with you.
One of the biggest problems that a lot of the Asian American communities have is this model minority stereotype. And a lot of times we, our mental health, our addiction issues are not highlighted because of the model minority stereotype. And so my talk will be focusing on deconstructing this model minority versus a problem gambler in the Asian community. So teasing apart that and also talking about how so important it is to disaggregate the data. And because right now when you lump all Asian groups together, it is really hard to identify the prevalence of problem gambling. So really, there's a lot to unpack here. Really looking forward to starting the conversation with the community. Asians in their countries have the same gambling rate as other ethnic groups. But the Asians who have immigrated from their countries, and like Asians in Australia, Asians in, the US, Asian in other countries, have a higher rate than the mainstream population. And so there's a lot of different factors that leads to this. So not only is it, there's a lack of awareness, it's underrepresented, I also want to make sure that when we talk about gambling, that it is treated with a nuance. Because I don't want it to be seen as a negative. It's, in a sense where how do you balance when it becomes an addiction, and how do you balance that gambling is also a part of the Asian culture. And, we don't want to vilify it. We don't want to take a cultural kind of trait or history that is not addictive, but part of social community activity, and kind of understand that balance. And so it's a very nuanced conversation, and so very important.
What ends up happening with the Hispanic Latino community is in the U.S. we might have some level of representation in data or in in research projects, because we are the largest and fastest growing ethnic group in the US. But what still happens, as it does with Asian communities, Black African American communities, Native American communities, is we're homogenized. And so it's kind of like all Latinos, all Hispanics, regardless of how they identify, where their heritage is from, what language they speak, they're all going to react the same way, present the same way, and you're going to be able to treat every single one of them, the exact same way. Even if you identify as Hispanic or Latino, You do not have to be an expert in the culture in order to best serve the community that you're working with. Instead, you just have to be patient, willing to ask questions, willing to understand that everybody's experience is different, right? Even if you grow up in the same neighborhood, have the same kind of family makeup, your experience is going to be, oftentimes very different. What are some of the misnomers about our community? Are we truly hesitant and hard to engage with? Or do we have a valid mistrust and a valid fear of what we might experience if we actually reach out and get help, right? Are we taking into account that a culture of stress really does, we really do experience these things? And how does that impact what we might think about, problem gambling? So that way we can educate our community. We can actually become trusted sources of information and help.
It's all about asking the right questions, engaging, learning the Latino cultural values and how all of those interact and come up in treatment when you are offering those clinical services. Or even in the paraprofessional world, right? I think, being a paraprofessional, a peer, a CHW, all of those are really valuable skills and jobs, and they help us in that trust, community building, and really enrich that all around services type of treatment.
Yeah, I really appreciate what Maxine and Ruth are saying, and very similar that I think that our current way of approaching services is we kind of standardize things and we try to force people into it, right? And oftentimes my students ask, how do I interact with so-and-so, right, with an Asian person? And even if you meet like 10 Vietnamese, they might come to America at 10 different period of times. They might have 10 different levels and type of socioeconomic and then, intergenerational traumas. And so I think it's like what I'm hearing what Maxine is saying, like this paradigm shift of like even thinking beyond that, we're not giving you like this is how you interact with, but it's really changing the way that you think about, people from diverse cultures and what they come to the table with. A lot of, treatment kind of see the clients in absence of the context of their family, of their environment. It's not just them, but then family is huge. And then their community is huge. When did they come to America? And then the social, economic, and or even the racial climate has a huge impact on our clients.
I really appreciate that you all are talking about the nuances of people's culture. And one thing that really helped me in my journey as a professional is when I had forms to fill out with check the boxes of check your race, right? I would just ask people, what race do you identify as? And what I really learned is very few picked just one. When they were able to just identify from their own and not have to be just checking a box, they might say, I am part Mexican and Black and this Native American tribe, or I'm part white and I'm part Japanese, or I'm part this and I'm part that. And very, very few would just be like, check one, right? Because our cultural identities and backgrounds and affiliations can be quite complex. And like you all are saying, that really has an impact on people's individual experiences, their needs, and how the healthcare system can best help them. If those in the healthcare profession are really conscientious to wanting to be more culturally sensitive in their practice and to help their staff and their team members along those lines, it's a journey and there's constant progression, right? But is there any kind of low-hanging fruits that you would say, if you can start doing this as a habit, you'll start to see some improvements here, and you might start to be able to build more trust with more clients?
I would like to offer that, especially, in an organization, one of the lowest hanging fruits is to go to the Office of Minority Health, Think Cultural Health government website, and familiarize yourself with the class standards. these culturally and linguistically appropriate services standards were put together very thoughtfully. And there are actually 15 standards where you can start taking a look at where within your agency, even if you have to start small, how are you going to start to make sure that you weave culture and language, at least considerations around those things, in everything that you do, right? One of the misnomers is that it's going to take $1 billion to do this, and you have to hire at least one representative from every single cultural background that is on the face of the planet. And that's not the case. And we know that resources are not a bottomless pit. Like, we understand that. And so just figuring out, like, where can you start? Can you start by just training, all of your providers to ask the questions, not to make assumptions. Even, we understand that a census form is necessary so that we get at least some demographic information about the people that we're working with, right? That we're providing services to. But as a Latina, I never know exactly how to fill out a census, right? If it's actually a good demographic form and it separates ethnicity from race, like, okay, this is a start. I can pick this one. But even when I get to race, right, like, it's not necessarily the most talked about topic in the Latino community. And so sometimes I struggle. And so I oftentimes choose other. So what does that mean to the person? So what happens is I take all of my time at the doctor's office, for instance, to fill out all of this demographic information. You're actually asking me these questions because it's going to provide value, not for some back end data retrieval where you're going to say, oh, we served X number of Latinos, X number of Asian community members, X number of Black African American community members, right? Like, if you're going to ask us for it, like, be ready to kind of implement it in the work that we're doing. And that seems really difficult until we really start to sit with folks and we do training sessions. And we open up every one of our sessions with a cultural introduction, and as proof that, like, we're all cultural experts in our own experience. And so if you can use that with folks, it actually could be very meaningful without a ton of training, a ton of money, but it's at least a place to start. And then the real work needs to be done at a, organizational level, from a bottom up, top down. So I would say that those are some really good places to start. One more thing, along the same lines of what we're discussing here, is it's not only the folks that we're providing services to or that we want to engage with more to provide more services to, but it's also within your own wheelhouse, like the folks who you're hiring and who are, doing the frontline work at an organizational level, also taking care of those folks. There's a really big difference between representation and inclusion. And so are we really meaningfully recruiting, interviewing, hiring, and training, and then building environments where those individuals feel like they're a part of a team, right? So for instance, if Dr. Dinh or Ruth are clinicians at an agency, is Ruth given every single person who checks Latino on an intake form? Is Dr. Dinh given every single patient or client who checks Asian on a form? And then, so what does that communicate to those folks, right? Like, are we really thinking about, is that the way that we should do it? Or can we find some other ways to really support folks? We do some behavioral health interpreter trainings, and we do them in English, which means that people who interpret for any language. And the number one thing that we hear is if a clinician, a behavioral health specialist is a provider, and then they also happen to be bilingual, and they're providing at some time during their day interpretation for their colleagues, for other providers. For instance, they're not given that time back or given credit for that time on their own productivity metric requirements or on their own schedules, right? It's almost an expectation, like Ruth, who is fluent in Spanish and does do interpretation. She's expected to do both, but it's not taken into consideration that she would actually not be able to see her own clients on her own caseload if she was interpreting for a colleague. And that's not to say that the system is intentionally doing something or the organization's intentionally trying to overburden Ruth. But again, that's one of those considerations that you can start to look at. And can we change the expectations for folks who are bringing in this very highly specialized and valuable skill set?